Grab that microphone.
It is official. We are live.
Ladies and gentlemen, we're live from the Santa Cruz boardroom. Starting a little bit late tonight, which is fine because the doctor was busy with some stuff, and we had a 12-pack of beer, so we were fine.
Yeah, it's a perfect combination.
So we were good. And tonight, ladies and gentlemen, on the Santa Cruz on the Off the Radio Show, which is on Facebook Live, Santa Cruz Ways, if you're not aware of that, the return of Dr. David Ghilarducci. Recently, I said that.
I'm amazed. Just amazed.
Because
you say it better than I do.
Right, because more people have butchered your name, right?
Oh, sure, yeah. No, it's kind of like the chocolate, only different, you know. Yeah.
We want to thank you for coming back because we wanted to come back and do a show, and you were here a couple months ago, and it was pretty bad. It was bad at the time. It was Omicron coming out, and you were masked up, we're all masked up. But you said one of the things I remember you saying was at the end of January, or was it February, that things were going to die down a little bit, and we're going to move. We're going to come out of this ahead. And it was a very positive show. You were very positive about what was going on, and you were right.
Well, yeah, I was maybe lucky, I guess, but
yeah,
some of these things are kind of predictable. Don't ask me to pick stocks, but
or horses,
or horses. That's right. Yeah.
But you were right. You were correct. I mean, this is you know a lot more than you did 2 years ago.
Oh, absolutely.
Right.
The things we've learned over the past 2 years about public health, about equity, about resilience, about our healthcare system, are just tremendous.
Yeah.
And we hope that these lessons will, carry forward for, heaven forbid, the next pandemic or the next, medical emergency or tragedy that happens. I think we'll be much stronger going forward. Yeah, you bet.
Are you and your staff sitting back and like relaxing right now, or are you still on high alert?
Yeah,
because
right.
It may be something coming down there may be something coming down the pike, or there may be another variant, or there may be this, maybe that.
Sure.
But right now, with the mask mandate going away, and I think it's very important for most people that have kids, the masks not being the new mask mandate with children not wearing masks in schools is a huge thing.
Yeah, it is a huge thing. Yeah, and we have been having conversations about how do we transition, how do we operate with this kind of different level of virus, a kind of understanding. Some of the things that we've learned is that, number one, we don't believe that this virus will ever be completely gone. It won't be eradicated. It's just not possible. The fact that it's so transmissible, it's throughout the world, it has animal reservoirs. You just don't get rid of a virus like that. Not like you could, say, smallpox or potentially polio. That's number one. But number two, the way that the virus tends to be sort of evolving is that it's going to be kind of a nuisance for us going forward. Now, people will still die. Vaccination is still important. We may have to bring back masks again at some point.
Right.
If we have another surge, which is probably, I would not be surprised if that happened. But it's important now that we're in this kind of relaxation mode. People need a break. It doesn't make sense to have mask mandates when transmission levels are low, when you're not seeing much in the community. This is a chance for us to kind of take a deep breath, if you will.
I've have friends of mine that have had COVID recently, and it hasn't been that dramatic as far as them having to go to hospital, or they just seem like it's been a flu on steroids, as it were.
Yeah.
But going back to your number one, 3 or 4 years from now, I'm laying in bed. God, do I have COVID? 4 or 5 years from now, let's look forward.
Uh-huh.
And I got the flu. Do I have flu? Do I have COVID? Do I have this? Do I have that?
Right.
Do I have right?
Right.
It's just going to be. Is it just going to be part of something that I may have?
Yeah, I think so. Yeah, as you think about it, I was just thinking about it as you said that, is we've probably all had COVID many times in our lifetimes because COVID.
I know I had it twice before COVID showed up.
Yeah.
I know I did.
Yeah.
I was so sick.
COVID is also the common cold, right? This is a very common virus. Now, this particular version, of course, was very, very serious, and all of the variant cousins. It's not like the common cold or even the flu, because it's killed almost 1 million people in the United States and many more worldwide. But the point is that it's going to be a virus that we live with, like we do with flu, that we do with other kinds of viruses. And what we have to do is really shift our thinking about what is our personal risk and what does the environment look like,
Right.
and really understanding what that means. And when I say personal risk, if you wanted to reduce your risk by 30 times, in other words, let's say you wanted to invest $1 and you wanted to be guaranteed that you got $30 back.
We're going back to horse racing.
Horses, there you go, right? 30 to 1 odds, right?
Right.
30 to 1 odds that you're going to win.
Right.
Who would not invest that $1? Well, that's what vaccination does for you, right? 30 to 1 odds that you're going to survive the infection.
So why wouldn't you get? Why are these people not getting that portion of population not getting vaccinated?
Well, there's probably a multitude of reasons. We've talked about this before.
Right,
There's
right.
kind of a mistrust of government, number one. There's misinformation in general about the health effects. People are worried that, these are brand new, that we don't know what the long-term health effects will be. The list goes on and
But
on.
isn't a person of my age, right, growing up in England, I got scars from here from when I was born, right?
Right.
Smallpox, measles. What other vaccines did I have back in the late 50s to ensure my safety?
Absolutely. Polio.
Polio.
Absolutely. Measles, mumps, rubella. You mentioned measles. Most adults have had 28 vaccinations by the time they get to our age. And it really has...
Can I ask a question?
Yeah.
How come no one got pissed off back then?
Yeah, there's a good question there, right?
Yeah.
Was it politicized? Now, when the polio vaccine came out back in the 50s, I'm a little bit too young for that, but I know the history of it. People were clamoring to get their kids vaccinated because it was such a scourge. A lot of people would get polio, have a mild illness, and be done with it. Others would get polio and be paralyzed, and it was really a devastating disease. It still is.
Right. I wrote on the thing here. Are we done with COVID? Do you think? As you say, it's never going to be over, right? Are we now the mask mandates are being changing? Are we going to go back to normal?
I think it depends on how you define normal, right?
Okay, I come into this store here, or I go to Deluxe Foods or Safeway, or
Yeah, if you're a healthy individual, if you're vaccinated, if you don't have anybody who's medically vulnerable at home, in the conditions the way they are now, you're probably just fine. But if you are, you do have some pre-existing conditions, if you're, have diabetes, you have some other medical issues that put you at higher risk, then you may want to take some precautions. So that's why I said about assessing your own personal risk and deciding what's best for you.
Okay. TC, come sit here. And you got questions?
Well, no, I just think that there's been some changes, I think, recently.
Your microphone.
Recently changes in the media. I've read some stories about the no masks for kids in schools.
Yeah.
And I feel locally that's been one of the biggest issues.
Yeah, right.
So when is that going to happen? People maybe who didn't read or follow what's going on with the rules or changing, when's that going to happen here in California?
Yeah, the date is it's in mid-March, where we expect that all mask mandates in schools will be lifted. It is possible that a school district may decide to keep some of those rules in place. But I think that what I understand locally, at least here in Santa Cruz County, that our school districts probably won't. Some of the things that we've learned over the past 2 years is that schools, and we knew this anyway, but schools are very, very important for our kids. It's important, especially for communities that have low resources and who can't afford childcare or don't have internet at home. That was a tremendous impact on our kids. And we didn't have really any choice early on.
The kids got it worse, more than anybody, right? You think the kids...
Well, they stayed at home.
Right?
Yeah, in terms of their social impact, absolutely.
Yeah.
And we also know that wearing a mask at school, the kids are great, they're resilient, they kind of go with it. But, there's some evidence to show that mask wearing at school does probably impair learning. It creates a barrier with the teacher and so forth. And so I think intelligent masking in schools is going to make sense going forward. So we're in a situation like this. We're now kind of in the trough. And if another little wave comes, it might be necessary to wear it for a while, the mask again. It may be really important to not send your kid to school if they have the sniffles, like we sort of always did, right?
Yeah.
And say, oh, you're fine, you'll be okay. We realize that there's actually more of a social consequence to that than ever before. Same thing about going to work sick. You know, I think some bosses used to say, man, that Joe, he's a great worker. He's feeling terrible, but he came in anyway. The boss should now say, why the hell is Joe here?
Right,
because he's going to get everybody else sick here. Right. He's going to ruin my business. Let me pay for him to stay home so he doesn't have to come in. And so
I'll tell you, as a business owner,
yeah,
it's really hard because I don't have a Joe to replace Joe with.
I know.
So that's really a tough part, because sometimes a hangover is
Yeah.
the sniffles. And I'm like, listen, bro,
Right.
it's Saturday morning. Is this a hangover or is this really the sniffles?
Yeah,
it's tough.
I understand.
No, it's pretty wild. I love the fact that, honestly, I feel so many people have been, the kid mask thing has been such an issue. What are we going to do? What's their next issue? Like, because it's political. So what's next?
Oh, yeah.
And let's go for 360. You just watched part of Joe Biden's State of the Union.
Yep.
Was there, and no, Neil, we haven't discussed this. Was there COVID stuff involved in that?
Absolutely. You know, I think one of the things, and I'm not a political analyst, but what I understand is Joe Biden is having some trouble with the polls. And part of it is because people had the expectation that he was going to come into office and he was going to fix this COVID thing. And obviously he didn't have control over Delta and didn't have control over Omicron. But the long-term strategy is really paying off. And I mentioned this a little bit before we started taping tonight. You know, we have tremendous vaccines. The vaccines are far more effective than any of us could have hoped for before they come out. That's number one, the most important thing. Number two is now we have these pharmaceuticals. We have pills and we have injections that are extremely effective in keeping you out of the hospital and keeping you alive. And so that is like, you know, a double layer of protection that we did not have a year ago.
So you've been vaccinated, right?
And boosted.
I'm boosted. I've been vaccinated, boosted.
Yep.
Is there something else that I should be looking at getting done now?
Well, yeah, there are a couple things. So there's a drug called Evusheld.
It's called, what is it called?
Evusheld. I don't know how they come up with these names.
So,
It's actually a combination of two different monoclonal antibodies, but that's beside the point. The thing is, that is a medicine. It's the only medicine right now that you can take, that certain people that are at very high risk, so people that are undergoing chemotherapy or have impaired immune systems, they can actually get this medicine. And these are for people that either can't get vaccinated for some reason or don't respond to vaccines. They can get this medicine as a kind of preventive. It's like a prophylactic, if you will.
Right.
So there's that. And then now there are, if you get infected and you get tested right away and you can get a prescription right away and get it filled, so there is this test to treat modality that's really important. There are pills that you can take that will keep you out of the hospital.
Prescription or over the counter?
They're prescription.
Okay.
Yeah. Yeah, and the reason they're prescription is they're not for everybody. It really depends on your medical history, what other medicines you're taking. The pharmacists have to, and the physicians have to be very careful about which one you get.
Can I use myself for a second, TC?
Sure.
I have a blood clot in my leg.
Okay.
Yeah, blood clot in my leg. You know,
Yeah.
with blood. I mean, I had one 10 years ago. Almost died from the damn.
can we get an update on your blood clot?
I don't know. I gotta go. I just.
Is it still there?
It's still there. I'm taking Eliquis, and so
Okay,
I gotta
right.
go. I have to go. I actually have. I'm gonna write a note to my doctor.
Well, a lot of people were
Give me
concerned
a-
about your blood clot, by the way. They've been wondering and
But
asking.
What about someone like myself, like that?
Yeah, well, you know, blood clots themselves, I don't think put you at higher risk. Although, a COVID infection can put you at higher risk for blood clots. So, if you have some proclivity toward blood clots, and some people do based on their genetics, then COVID could be more of a risk for you. But in terms of vaccination, in terms of these medications, that's not a factor.
Is there something changing? Oh, go ahead, Neil.
Should I ask my doctor for those for the new prescriptions that are out?
If you test positive.
If I test positive.
If you test positive, yeah. So
Okay.
those other ones, yeah. Now the EvoShield really is reserved
Right.
at this point for people that are, in these kind of
Higher.
high risk tiers.
Right,
yeah, you
right,
would
right,
not
right.
fit in that.
Okay.
Yeah.
What I was going to say is there something changing for people who are not vaccinated as we ease up some of the
Yeah.
mandates right now? Because I thought I read something that you won't be able to ask for a vaccine in the future. Is that I may be wrong.
Like for a vaccine verification.
exactly,
sort of
yeah.
thing.
Is that something that is changing in California right now?
No, I don't think so. So there are changes in terms of masking that, in certain settings, of course, we all still have to be masked, like in a medical care setting or transit, that sort of thing. But in terms of whether you should be wearing a mask or not in like a business like this, if you're unvaccinated, the recommendation is that you still continue to wear a mask. Masks are still strongly recommended for everybody, but particularly if you're unvaccinated. It's up to the individual business or entity to decide whether they want a vaccine verification.
It's interesting because I went to USC recently. Couldn't step foot on that campus without a vaccine.
Yeah, right. Yeah, and
You
I
know?
just went to the LA Zoo and to the Griffin Observatory last weekend, and that was the same. So LA County does have that rule. Whether they'll change that rule or not is another question, but I think, let's take a look at it from a business perspective, right? Let's say that you're running a nightclub. Let's say you do shows at the Coconut Grove, like my sister and her husband just went to a couple nights ago. Having a vaccine verification system in something like that is probably very reassuring to all the other patrons,
Heck
right?
yeah.
And so I think it's actually a smart business move in some settings to actually require a vaccine verification.
Yeah.
Well, and
I went to the grocery store the other day, TC. I went to, when I'm watching a grocery store, big signs. If you've been vaccinated, you don't have to wear a mask.
Yeah.
yeah.
But I look around, everyone's wearing a mask. And
Yeah.
I didn't want anybody like, like, I just want to get my grocery, get the hell. But guys, we don't like grocery shopping anyway. But so like I wore that. I wore it because I didn't want to get it into a beef.
Oh yeah, there you go.
On the cereal
It's like
aisle.
a social norm.
Right.
Earlier, Neil, I said to you that I walk into a business, I always have a mask, and I wear it out of respect for the employees. Because there isn't a mask mandate right now for most businesses.
Yeah.
But if I walk in and the staff's wearing a mask, I'll wear a mask.
Yeah.
Absolutely.
To
100%.
make them feel more comfortable, right?
Absolutely.
Yeah.
It's about respecting each other.
Yeah, that's my point too. Right.
I wanted, obviously, there's a war in Ukraine. And I
Yeah.
mentioned to you earlier, I saw all these people on the subways, and I was thinking, oh my gosh, there's a vulnerability right now for transmission for these Ukrainians whose hospitals are like pretty much out of business.
Yeah.
Have you watched some of that? Have you
I
feel
sure
the same
have.
way?
Yeah, I've been watching a lot of that. Yeah, they're crowded into subways that are, doubling as bomb shelters, just like the London Underground in World War II. When you're in that kind of crisis, probably the last thing you're going to think about is something like wearing a mask to prevent a viral infection. You're just trying to survive at that point. And so, yeah, that is a risky situation. And we saw similar things. We were very concerned when we had the fires last summer with our fire shelters and making sure that the shelters themselves did not create another problem with COVID. And, that was a little bit more controlled conditions because we were able to resource that. But in something like Ukraine, just a double whammy. And in war zones in particular, we see the reemergence of infectious diseases, all kinds of infectious diseases in general. You'll see cholera, you'll see, measles, all these other things that are normally controlled when the society is functioning well.
Right.
And I would imagine Ukraine probably has a pretty good vaccine situation going on.
Yeah, don't know the numbers there, but I would imagine they're okay.
Let me ask you a question. I do this,
Yeah.
right?
Yeah.
You gonna shake my hand?
Uh-huh.
Did you ask me if I'm gonna get back? Was I vaccinated or boosted, or are you putting your trust in me?
Well, listen, shaking your hands is very low risk to me.
Okay. Why?
I mean, I wash my hands frequently.
Okay.
You may or may not. I'm sure. Assume you do. But as long as I'm not like touching my mouth and doing
Right,
that kind of
right.
thing, I think that's a low risk activity.
Okay, all right.
Currently in Santa Cruz County, how are we doing? How's things going?
Things are going well. I think last time I talked about the tsunami coming.
Yeah.
We're on the backside.
Was that before the tsunami?
Well,
that
I
we
think
actually
it might
had?
have been on the upswing when we
No,
spoke
the
last.
actual tsunami. That
That tsunami.
yeah, was that about the same time?
Yeah, I was talking metaphors. I guess I should have meant the whole thing, right?
We actually had a tsunami.
Yeah. The horn almost sank.
It did sink. Are you kidding me? That thing sank.
I think we've had 2 tsunamis in Santa Cruz in
Yeah.
the last 10 years,
Right.
but just amazing. But I think it was before that,
Okay.
real tsunami. But we're going to see more wavelets. We're going to see more swells coming through. I can guarantee that.
What's the new one?
Well, it's something called BA2,
I saw
which
it,
is
yeah.
BA2, right? And it
Is it
doesn't get
scary?
a Greek letter yet, but it's probably a relative of Omicron. A little bit scary. It seems to be a little bit more infectious than Omicron, if you can believe that. Remember, Omicron is about 30 times more infectious than the alpha or beta that we dealt with before Delta.
And that got slowed down because of the vaccines. Yes.
The BA2, I think so. Yeah, I mean we're seeing some penetration. It looks like if you're vaccinated or if you've recovered from Omicron, you're probably safe from BA2. There's some thought, and we don't have enough data yet. Some thought that BA2 may be a little bit more pathogenic, which means that it causes a little bit more severe disease than Omicron.
Have you found out there's a lot of people out there in our community? I'm over it.
Oh yeah,
You know what? I'm done. I'm
Yeah,
over
yeah,
it.
yeah.
Screw the mask. I'm over it. I'm done.
yeah. It's funny.
People taking it for granted a little bit, right?
There could be some of that. I think Santa Cruz is a pretty conscientious place, to be
Right.
honest. And I just went skiing, and have you ever been skiing in Grand Targhee?
Yeah, I have.
Tetons, yeah.
Yeah.
Yeah,
You know what? The
little
chairlift is so old, you get split in your ass.
but they've upgraded most of the
Oh, they
chairlifts.
have?
Yeah, but there was one on the backside. I didn't remember it was kind of like that. But
Yeah.
Anyway, that's what we call.
That's in the middle of nowhere.
That's like Idaho.
And
Yeah.
there's no,
Wyoming, Idaho.
and usually
Yeah.
locals say, "There's no corona here."
Oh yeah. So yeah, like you say, I go into the grocery store. I'm the only one wearing a mask. I felt a little bit conspicuous, but it was okay. Nobody hassled me or anything.
Yeah.
They maybe
Yeah.
said, "Oh, he's an outsider."
I just talked to a friend of mine today. She lives in middle of nowhere in Utah. Because I never wore a mask. I've never seen a mask.
Yeah.
I've never seen a mask.
Right.
But it's interesting. You go New Leaf up the street, and I would say 90% of the customers in there have a mask on. So I feel like Santa Cruz is conscientious of that.
Yeah.
For
And
the most
considerate
part,
to each other, like you said.
I feel like we've been doing a great job on that.
Yeah.
Is that worldwide? Because in America, I feel it's kind of frustrating because it's kind of like if it's become political, right?
Yeah.
You think?
Yeah.
And I saw recently Cuba's like 90% vaccinated.
Yeah.
And I was like, how did Cuba get everybody to get a vaccination?
Yeah. I do think that some of this is uniquely American, but we saw the trucker protests up in Canada near was it Windsor, Canada, near
Yeah.
near Detroit, just above the border, and we've seen some of these protests, kind of far right protests in Austria and other places in Europe. I think that is continues to be the minority. For some reason here in the United States, and this is just my personal opinion, I think that resistance to government is an act of patriotism to some people. And that sounds counterintuitive, doesn't it? Right? But I think that people have sort of worn this kind of fight the man sort of attitude, and this is part of it. Nobody's going to tell me whether I have to wear a mask or get vaccinated. And so it's become more of a badge of pride here than I think elsewhere.
Well, and I think we actually came here because we ran from that same message. Right, like in the very, very beginning,
Yeah.
we all were like, "We're not going to pay taxes and screw all these guys. We're going to go hang out in America," and we're living that again right now. It's pretty interesting.
I think we are, though I think the motivation is somehow different. I worry about the rise. We're getting off topic here, but I worry about the rise of authoritarianism. Not only here in this country, but we see elsewhere. I think Putin's a fine example of it.
Yeah.
Lukashenko in Belarus, and there's some others out there that have been promoting this far right message that is, I think, a little bit more toxic than just simply, shrugging off the oppressive king of England.
For sure. And I think there's a few people on some of the networks currently on television that may be on payroll for that. To like promote that message here in America.
Yeah.
And to perpetuate it. I wish that everybody just wanted to make our country healthier, because what everybody's asking for is just that.
Yeah.
I don't want to wear a mask, so I'm going to drive a truck to Washington, D.C., and I'm going to protest it. Well, if we just got vaccinated, it's like, it's that easy, right?
Yeah.
And I have some friends who it's become a hobby to just be against everything.
Yeah, right.
And I remember, like, I had a friend who is really into war history.
Mm-hmm.
And in 1944, 45, there was no politics involved. It was only about people rallying around to defeat something.
Yeah.
And if COVID could have been that way in this country, I would have employees dropping off applications every day. We would have a beautiful non-mask reopening months ago.
Yeah, I agree.
And that has to be your frustration.
Well, yeah, and I think I might have even mentioned this before, but, I read stories of, people would donate their pots and pans. They would save the gum wrappers that were wrapped in, your stick of gum was wrapped in aluminum.
Right.
That was saved for the war effort, and that was what people did.
Right.
And there was no question that this was a collective effort.
Right.
And we seem to have lost that sort of sense of being in this together, that collectivism.
Because everybody wants to take care of numero uno themselves.
Yeah, exactly.
I think currently, I'm just going to say from the little bit of stuff I've been able to see, Ukraine's got that right now.
They do. They have something to rally behind, right?
Yeah. There's such a unity in that country right now, and I feel so terrible for them because, the of age males can't leave, and so they're taking their wives and their children to the border and saying goodbye. And I'm gonna go lob Molotov cocktails at tanks.
Yeah, right.
Right. And oh my God, I just literally, it just tears my heart to think about what's going on there and how under weaponized they are.
Yeah.
They're going into a knife fight with a pebble.
Yeah. Yeah.
Doc, can I ask one thing you've learned? The most important thing you've learned since COVID began.
Wow.
In a man of your position, or.
Yeah, I think maybe I would say that I went into it with a little bit of naivete and thinking, all I have to do is...
That's kind of a blasé type of thing?
Just kind of maybe Pollyannish. I say, all I have to do is give the public the data, and they'll do what's right. And I've learned that that's not necessarily the case, and that there are very complex reasons why people don't listen to data or don't understand it or dismiss it. And so that's something that I've come to appreciate more.
And my second question is: Are you still pushing the rock up the hill, or do you think you've got over the top? You're coming down. Coming down the hill now.
So am I Sisyphus or not? Is what if the hill is the most recent surge, we're definitely on the downswing. We're rolling downhill right now. But
don't take things for granted.
I think that's the message, right?
Keep look in the rearview mirror, see what's coming.
Yeah.
Right.
So my message to the public now is, hey, we're doing great. You've got a chance to relax. Let's hope it continues. There may be a chance we may have to put a mask on again. We may have to get another booster at some point.
So the mandates are not.
But it's not the end of the world.
Right. The mandates aren't the end. We're done. This is just what's going on right now.
Currently.
What's going on right now. And it could go back up again. So don't get comfortable.
Yeah, well, I say go ahead and get comfortable. Just have an expectation that we may have to try, we may have to go back to what we were doing for a short while again.
Well, and we've been in wintertime. People normally, it slows down a little bit in wintertime.
Yeah.
We're going to have a big spring break. The beaches are going to be full all summer.
Yeah.
And we got some new Omicron that
Right.
we don't really know a lot about.
Drink a lot. What you gonna do? You know, TC?
Yeah.
Go the Irish way. Just drink Guinness.
Exactly. I wonder how the Irish are doing. They're just drinking it down. Yeah, it's like,
Well, he's Italian, so I don't know.
Well,
But
we
it's-
Italians drink Guinness too. Right?
Yeah.
so I guess what you're saying is like, don't be surprised if we go all back outside and have a great summer, and this new thing slides in, and we have to put a mask back on.
Yeah. Right.
Who knows?
Yeah.
Right.
We're used to it.
Yeah. Wow.
We're used to it. Doctor, thank you for coming back on the show.
Yeah, I appreciate
Oh,
it.
my pleasure. Yeah.
There's a lot going on, you know, with the changes of the kids, and I really feel like I know some moms that really were so supportive of the community effort to stop it and to be a part of it until their kids had to put a mask on,
Uh-huh.
and then it changed, and they became like this, mama bear.
Yeah, I think you got to be careful. I think it was a very vocal minority that we heard from.
Yeah, yeah.
And so for the most part, I think people just understood it and went along with it.
Yeah.
So these parents are what's the best vaccine for kids? Is there one that you like?
Well, the only one available for kids at this point is Pfizer.
Okay.
And it gets trickier as the kids get younger because their risk of disease, of severe disease, does go down quite a bit. So then you always trade off the risks and benefits of vaccination. And so, we're still waiting for some data, especially for the really young kiddos below the age of 5, to understand more about whether vaccinations are beneficial for them.
Our hospital, I mean, Dominican, it's in good shape.
They're in good shape, but they're busy.
They're busy with COVID stuff.
Not so much COVID. We got people in there with what I call incidental COVID, so they're being admitted for other things, but then they happen to test positive for COVID.
Oh.
Okay.
We have a couple of people in the ICU, a couple of deaths lately that are unvaccinated, so I call those preventable deaths, really.
Right.
For whatever reason, they chose not to get vaccinated. Younger people in their 50s and stuff,
Right.
Is there a ratio of that, unvaccinated deaths versus vaccinated?
There is a ratio. It's about 30 to 1.
30 to 1.
Yeah.
Wow.
So for 30
terms of
people
deaths.
who die,
Yeah.
they're unvaccinated.
Yeah.
And then one dies and they're vaccinated.
Yeah. And usually the
Wow.
one that dies that's vaccinated has multiple other medical
Like a heart
problems.
failing or something
Yeah,
else.
right.
So I guess the question is, why wouldn't you want a vaccination, right?
Seems fair to me.
Is that right? 30 to 1.
I don't think
And that's not...
You're gonna sit here for 2 hours.
That's not fake news, right? Is that fake news? That's real. That's real, right? That's a real stat.
That's a real stat.
30 to 1.
Yeah.
Okay, I'm happily vaccinated and boosted, by the way.
Thanks,
Yeah.
Doctor.
You
Yeah.
bet.
Well,
Thanks.
dedicate
That's-
this show to Gail Newell. Dr.
Oh, Gail,
Newell.
yes, my
Well,
hero.
Dedicate the show to her and wish her well and
Yeah.
look forward to having her. We love you.
Yeah.
But we'd like to have you both of you back here. It'd be great.
You know
And
what?
she'll be on time, I'm sure.
You know, it'll be great to have the final curtain show.
Oh, okay.
You know,
Yeah.
we're moving on.
And please know, if you're late, don't worry about it because we always have a 12-pack of beer. So
Good thing, yeah.
yeah, we're always good.
Well, that's why I'm upset about being late. I could have gotten started earlier.
Yeah, I know.
I just want to reiterate, 30 to 1.
Yeah.
The people who are passing away from COVID,
Yeah.
30 unvaccinated, 1
There you go.
vaccinated.
That's right.
Oh, man, that's gnarly.
Yeah.
Okay. Neil?
You can't,
Yeah,
you
there's
can't-
just
you
you just can't even top that. That's
You know-
amazing. So
You know,
I,
when you beat your head against the wall, you know what feels good? It's when you stop.
yeah, that's crazy.
Yeah,
that's
there you go,
That's
right?
That's a crazy stat, and I just hope that gets through the heads of a couple people. You know?
Thanks,
I hope
Doctor.
so. Yeah, you bet.
Love you coming on the show.
Santa Cruz Waves, T Fox. Thanks for having us tonight.
Thanks for that.
Yeah.
Love response. We got a burger from
Betty-
we got Betty's Burger sponsor the show. If you want to check out the sponsors, go to authorradio.com. This show will be on YouTube later on, as well as iHeart, all the podcast platforms.
Just Google it. Off the Lip Radio Show. Yeah.
You'll be going. Who knows? The next show, we don't know what the next show is. It's coming up.
We had a great show the other night with the Beach
Beach
Cowboys.
Cowboys.
Beach Cowboys. You guys check that show out. They were great. And next week we're taking a little siesta
Yeah,
next
yeah,
week.
you're-
Little
yeah,
siesta
yeah,
next week.
yeah.
We'll see you guys soon. Thank you for tuning in.